I think that nurses a lot of times went in to take care of people and to help people in their bad situations. And the harder and harder it gets to take care of patients and to provide them the care that we want to provide them, um, makes a difficult job of nursing more and more difficult. So the burnout, especially of bedside nurses, is so huge. I mean, I left the bedside and went to endoscopy because I knew one of two things had to happen. I either had to stop caring or I had to leave my job because I couldn't keep doing my job. I couldn't do what I needed to do for my patients. And so I left the bedside.
I got into nursing because I wanted to care for people. I want to help them, empower them, and make them feel better. But when we're short staffed, when I'm short staffed and I don't have the amount of nurses I need to give people adequate care, it's devastating because I know I'm not doing the best I can do and I'm not giving them what they deserve because you can only be pulled in so many directions. Hospitals are cutting back in every area, not just short staffing nursing. They're taking away secretaries, transports, and aides that help us give appropriate care, and it's the patients that are suffering and the staff. I often think about why am I still doing this if I can't give my patients the care they need. Nurse burnout is real. When you work 12-hour shifts and you're not getting breaks to care for yourself because you got to care for your patients and you're still not giving them that type of care, you start looking to what else could I do? Wanting to go back to a 9 to 5 job where you get to leave on time, you get your breaks, and you're not stressed out and worried about what did I miss? I couldn't do this, I couldn't do that, and it's no fault of mine if I don't have the staffing, but I feel like it's my fault. And that's placing an unfair burden on the nurses that work at the bedside because we're feeling the stress of not being able to care for our patients appropriately. And in turn, we're going elsewhere because we can't take not being able to give people what they need.
I was always taught, that crying doesn't solve problems, with my parents. And then, of course, I went to the military, so that even polished it even some more. So it's very difficult to talk about because we don't want to say that we're weak and that we can't do this. But every day we have to come back and be strong for our patients. And it's hard sometimes to come back and do it again and clock in. And it hurts. Do you get over it? No. Sometimes it takes months, years, maybe never. And I feel like someday that it's gonna change. It has to change. Even if it has to be me to make that change.